हेलो एवरीवन, आज हम बात करेंगे बड़े इंपॉर्टेंट एक सिम्टम के बारे में विच इज कॉफ। उसमें भी क्रॉनिक कॉफ या लंबे समय तक चलने वाली खांसी के बारे में। तो बाय डेफिनेशन एनी कॉफ विच इज मोर देन 3 वीक्स इन ड्यूरेशन इज कॉल्ड क्रॉनिक कॉफ। सो व्हाट इज कॉफ? Cough is basically a very important defense mechanism of our respiratory system by which हमारा respiratory system कोई भी माइक्रो, म्यूकस या फॉरेन बॉडी को रेस्पिरेटरी ट्रैक्ट से बाहर एक्सपेल आउट करता है। बट अगर यही कॉफ लंबे समय तक चले तो इट बिकम्स अ मैटर ऑफ कंसर्न एंड वरी फॉर द पेशेंट। सो व्हाई इट इज इंपॉर्टेंट टू टॉक अबाउट कॉफ? पहला तो ये कि दिस इज प्रोबेबली वन ऑफ द मोस्ट कॉमन सिम्पटम जिसकी वजह से पेशेंट्स विजिट अपना डॉक्टर और पल्मोनोलॉजिस्ट। अगर लॉन्ग स्टैंडिंग कॉफ है तो इट बिकम्स अ कॉज ऑफ फ्रस्ट्रेशन, वरी, irritation, lack of sleep, lack of work performance, and even आज के pandemic में if someone is persistently coughing, it becomes a hindrance in social interaction also. अगर cough के reasons की बात करें, what can be the reason for long-standing cough? The first and most important is sinusitis or postnasal drip. So what can be the symptoms? Symptoms can be बार-बार छींके आना, नाक बहना, नज़ला जुकाम हो जाना, बार-बार थ्रोट में इरिटेशन रहना या सूखापन रहना, और पोस्टनेजल ड्रिप which is like जो secretions है उसका बार-बार continuously गले में ड्रिप करना, उस टाइप का sensation which can give rise to irritant type का cough. So it can be the cause of long-standing cough. इसके evaluation के लिए आप अपने डॉक्टर से मिलेंगे तो he can advise you for some X-rays, for some sinus X-rays or chest X-ray, and can advise you some medications, antihistaminics, and some nasal sprays. You can take steam inhalation and gargles for some soothing effect. दूसरा जो important and common cause है that is bronchial asthma और chronic bronchitis. So bronchial asthma में आप लोगों ने सुना होगा the most common symptoms are wheezing or breathlessness, but no, not every patient of bronchial asthma wheezes, but some coughs also. So that is known as cough variant asthma. कुछ patients में सिर्फ coughing होता है and it needs a high index of suspicion on the part of your clinician to diagnose a cough variant asthma. अगर इसके chances उनको लगते हैं तो they can advise you for a pulmonary function test, and even if pulmonary function test is normal they can offer you some inhalers, and on the basis of response to inhalers we can arrive to a diagnosis of asthma. Other thing which I said is chronic bronchitis. Chronic bronchitis is mostly seen in smokers. So in smokers it is also known as smoker's cough. Smoker's cough because जो nicotine या जो chemicals हैं it can irritate and also can give inflammation to your like bronchial mucosa, bronchial wall mucosa, which can give rise to long-standing coughing. So treatment can be as simple as quitting the smoking and also leading a healthy lifestyle. So another important cause of long-standing cough or chronic cough can be gastroesophageal reflux disease, gastritis or acidity. What happens is stomach के जो content है वो wrong direction में esophagus में आते हैं and then they can irritate your vocal cords and even go down in your windpipe and can cause coughing. So the treatment would be as simple as avoiding all kind of spicy foods, fatty foods, caffeine, citrus fruits, tomato soup, all these things can give rise to acidity, so avoid these food. So another common cause of chronic cough is certain medications which patients are taking because of like hypertension. So BP की medication जैसे ACE inhibitor अगर आप लंबे समय से ले रहे हैं it can cause coughing. So the simple management would be to avoid these medications. आप अपने डॉक्टर से मिलिए, they can change your medication and आपका cough will be better. So to end the talk, I would like to say कि coughing हमेशा जरूरी नहीं है कि जैसे allergy हो या asthma हो या bronchitis हो. Sometimes it can be indicator of some serious illness, like it can be a symptom of lung cancer or certain serious problems going on with lungs like pneumonias. So never ignore such symptoms. ऐसे symptoms को कभी ignore ना करें. अपनी consultant physician से या फिर pulmonologist से जाके जरूर मिलें और इसको evaluate करें. Thank you.